Welcome to Health Sciences Update, a program about health sciences education and research on the Washington State University Spokane campus. I'm Doug Nadvornik. Our subject today is the new WSU Medical School. On April 1st, Washington Governor Jay Inslee signed into law a provision that allows WSU to create its own independently accredited medical school. Since then, administrators from the College of Medical Sciences have been working on the process needed to earn national accreditation for the new school. Here to talk about that is Ken Roberts, the acting dean of the college. So let's set aside the startup funding issue, since we don't know yet from the legislature how much money we will get for that. But let's go on to the work of creating a medical school. What's involved in that?
Well, it's actually a long process to completely get through the accreditation process. It takes about 4 or 5 years, but we're in the very early stages of that, doing what we call preliminary accreditation, where we are putting together the curriculum for the new school, assembling all the committees such as admissions, curriculum, and so forth that govern what happens in the medical education program, assembling committees that govern how faculty operate and so forth. There's many aspects to this. And we're putting all this material together for our accreditation body, which is the Liaison Committee for Medical Education, or the LCME as we call them. And we put all this information together for them very early on and submit it to them so they can take a look at it, make a judgment of whether or not this was going to be a good program, a quality program. That's followed by a site visit and then permission to recruit students into our medical student if all goes well with that process.
So how early did all this start?
Well, it depends on what you call it, where you would put the official start. We've been working on curriculum ideas for quite some time with our faculty here in the College of Medical Sciences. But in the last couple of months, we've really ramped up the intensity of this kind of planning. We've engaged several more clinicians as clinical faculty to help us design the curriculum and to do this work. And so I would say in the last couple of months, it's really ramped up, and it will continue to ramp up into the summer. We're trying to get all this material together for submission to the LCME by the end of August.
So give me a better idea of what sorts of things that they're asking you for.
Well, they accredit a medical school around 12 standards, which are all various aspects of the educational program. And so we respond to questions relating to those various 12 standards, things around student support, curriculum, as I just mentioned, student progress, admissions, and so forth. So we're in the process of answering these questions in their format, okay, and in a way that they can assess them and how well we're making progress.
So WSU Spokane's been in the medical education business since fall of 2008 as part of the Whammy program. Did that give you a leg up on this process?
Yeah, absolutely gave us a leg up. So we've been delivering first-year medical education, as you mentioned, for some years, actually in Pullman, over 40 years. But our faculty here has 7 years of experience doing this. In the last couple of years, we've gained experience in the second year of medical education. And those first 2 years are really under the microscope for the accreditation process as we begin. We have to also give information on how we'll conduct the third and fourth years, but there are further steps where those details are filled in. So right now we're doing a lot of development around medical education that we've already done before. So that gives us two advantages actually. One is we have some working knowledge of what it is that we need to do. That's very important. But the other is that because we've actually had first and second year medical students on campus delivering the medical education here, the campus and the infrastructure and the College of Medical Sciences basically already has substantial numbers of things in place that already are at a level acceptable for accreditation. So a bit of a head start, if you will.
So let's take a step back on medical education. How does it work? The first 2 years are on campus, and then what happens?
Yeah, so first 2 years are what typically referred to as the basic science years. So they occur on campus. There's a lot more work in the classroom and so forth. Although we do give students early exposure to the clinics, the main thrust of the education is around that basic science underpinning of medicine. As they go into year 3 and 4, there's a complete shift to a focus on learning the clinical side of medicine. So we call year 4 the clinical years. And that's when the students leave the campus for the most part and do most of their education in hospitals, in clinics, outpatient settings, inpatient settings, and so forth, with preceptors who are physicians teaching them basically the different specialties.
And where will those third and fourth year students be? Will they all be in Spokane?
They will not. So we are proposing a distributed program. It's community-based. So So our teaching on the clinical side will be in partnership with existing hospitals and clinics. So in the initial rollout of our program, we'll have students doing their third and fourth year in Spokane, some of them doing their third and fourth year in Tricities, some in Vancouver, Washington, and some in Everett. So we'll be distributing that education around the state, not overtaxing any one particular location with all this clinical education, but really spreading it around, and also giving multiple places in the state the benefit of participating in medical education.
So how far along in the process are you building those relationships with those places where you want your third and fourth year students to be?
Well, we're well into the process, but we're not anywhere near done with the process yet. So we've made several visits to the 4 places I just mentioned, but also a number of other places in the state. Because by the time this program is mature, we think we'll be educating medical students in additional places besides those 4 cities I just mentioned. We also want to structure our program so that students have ample opportunity to have exposures in more rural places, because we're very interested in the rural underserved pipeline for our physicians as well. So we've started building those relationships. We've made a lot of contacts with clinicians, with clinical administrators, with hospital CEOs, and also a lot of important stakeholders in the communities where we'll be to explain our plan, how we're planning to engage with them. But it's an evolutionary process, and we move through the process. We organize, kind of how will the teaching take place, how it will be administered, and so we're working our way through this process such that we're ready to have clinical students in those places 3 or 4 years from now.
So Spokane was obvious, but why Tri-Cities, Vancouver, and Everett?
Couple of reasons, in no particular order. One is that WSU already has branch campuses in those communities. So we have a university footprint there that allows us to more easily work in those communities. So that is the fortuitous part. But in the more mission-driven part is these are all key areas of the state where we don't have enough physician supply. So we know from experiences in other states that where you do medical education is a place where physicians tend to locate, both because physicians who train there will stay there or come back when they're finished with their training, but also because the educational activity around medical education is attractive for recruiting physicians in from the outside. So by distributing the program in this way, we're going to help distribute physician supply in Washington state more evenly, because right now we have a situation where we have a fairly heavy concentration of physicians in the King County area, but a lighter distribution in the rest of the state. So we want to sort of equalize that using this strategy.
So you're submitting your first documents later this year, probably by the end of the year, 2015. How does it go after that?
So this is the first step, as I mentioned. The LCME will take a look at our materials at a committee meeting at the end of the year. If that material looks good to them, which we are fully anticipating it will, they will come site visit us. They'll actually come to campus and make sure that all the things we've said actually will play out here on this campus. And then following that, all those things being favorable, they will give us preliminary accreditation, which allows us to begin recruiting that first class of students. So if you're following the timeline, that would put us into the summer of 2016 or late in the summer. And at that point in time, we'd actually be given permission to go out and begin seeking students to be in the classroom in the fall of 2017.
So I can tell you from personal experience, you've seen these letters too, that we're already getting letters from people who want to go to a WSU medical school. What can you tell them and what can't you tell them right now?
Well, the most important thing that we can't tell them is to send an application. So when you're on this side of accreditation, that is the front side, you're not allowed to recruit students. You're still very much in the planning process. So basically all we tell people who are inquiring about the program, our prospective students, is basically what we're planning the program to look like, and basically what its missions and values are that I just mentioned, primary care, rural underserved physician supply, and so forth, so that they can start thinking about, do I want to go to a program that has that as an emphasis, for instance. It won't be until the LCME gives us that thumbs up that it's okay to actively recruit that we will begin replying to those inquiries with, contact our Office of Admissions, and we will send you application materials.
Yeah. So you're hoping by the fall of 2017 you're going to have that first class in. And are you fairly confident about that right now, or is that still a moving target?
No, very confident about it. And here's the reason. It is a very aggressive time frame. And that aggressiveness is upon us because we're in it now, in the planning process. So we know that it's an aggressive timeline, but it is the timeline that most schools accreditate on, if I can say it that way. So in other words, about 80% of the schools that get accredited, and there's been several in the last 15 years, work along this timetable. So it's very aggressive, but still at the same time very doable.
So what sorts of response have you gotten when you've gone to the Tricities, to Vancouver, to Everett, to those other places in between? What are they thinking about a new medical school?
Well, by and large, the reception has been very enthusiastic. I think, especially when we're talking to the clinicians and the hospital CEOs and those who know how difficult it is to recruit physicians and to maintain their physician workforce, they're very excited at the prospect that we would educate more of our own medical students in Washington State. And they're also familiar with the different kinds of retention issues and what it takes to recruit a physician from the outside and so forth. So they're very enthusiastic, very hopeful that this will help. At the same time, they have a lot of questions about what's this going to look like, what does it obligate us to, what's the medical school going to do, and so forth. So we're in that process of explaining what our goals and aspirations are, but also trying to ferret out some of the details and what the impacts will be and so forth. But if I had to just characterize it, overall there's a high level of enthusiasm for this project. And interestingly enough, it's not just enthusiasm in the Spokane community, which is where this will be headquartered because we have the first 2 years here, but the enthusiasm is equally as strong, if not stronger, in some of the other locations as well.
So your staff is very busy right now trying to pull things together. How does the community fit into the accreditation process?
Well, there's in a couple of ways. One is, as I mentioned, we're actually hiring a fair number of clinicians from the community to help us actually do the curriculum and the planning process. But there's a very important engagement component of this accreditation process, which is the part of it we call the self-study. So after we compile all of our information to submit to the LCME, we invite a group of stakeholders, a fairly large group from Spokane, from the places we intend to do our clinical education, and we ask them to comment on the plan and to show us, which parts of this they're really excited about and they think are great, which parts of this do they think are weak and could be better, which parts have we not thought about and should incorporate, so it sort of has a visionary aspect. But this reflection on our plan is a very valuable feedback for what we plan to do, but also it can help provide guidance for our evolution and making it better as we go forward. So there'll be a lot of opportunity for the community stakeholders to interface with us at that point.
So we're in our last minute. Over our shoulders, they're breaking ground for the new Spokane Teaching Health Clinic. How does medical school fit into that?
Well, in a couple of ways. We intend to have medical students there, but the clinic, and we're going to have trained residents there, of course. But that is a site on campus where we intend to do interprofessional education. So it's going to be a place where all the different health science programs on this campus can come together and design interprofessional training opportunities or educational opportunities that will help set our students up as they graduate to go out and practice in a team-based setting where everybody is maximizing their effectiveness, operating, if you will, at the top of their license. So we're very excited about that facility because that really is sort of the crowning piece of our curricular design components. So we're very happy to see that ground being broken.
So we'll bring you back in a few months and we'll talk more about that and other things. Ken Roberts is the acting dean for the College of Medical Sciences. This is Health Sciences Update.